Good evening, welcome to Health Quest. I'm Deborah Arneson, your host for the evening, and we have a great show for all of our viewing audience this evening. We have once again one of my dearest guests, Aaron Bartz, who is just a wealth of knowledge, and he's here to share with us information on your cardio health and the health of your heart. So we're going to talk tonight about all kinds of things that have to do with cholesterol and the #1 killer in America, which is heart disease, still unfortunately to this day. So Aaron, thanks for being with us.
Thank you for inviting me.
It's great to have you back.
Yes, thank you.
Yeah, I know, you're squeezing me in all your travels here, and he's out there just sharing this information of wealth with so many different people around the country, educating.
Yes.
So we're thrilled to have you.
Thanks.
So let's talk about cardiovascular health. Tell me something. What role does cholesterol serve in the body, and is all cholesterol bad?
No, all cholesterol is not bad. Actually, cholesterol plays a role in many positive things. It helps produce sex hormones. It helps produce bile acids, which actually help with your digestion. So there's many positive things that cholesterol does. Cholesterol, what we're worried about from a negative point of view is when serum cholesterol or cholesterol in the blood becomes elevated. That can lead to atherosclerosis and other potentially heart disease, and that's what we get concerned about from a negative point of view with cholesterol.
So basically what cholesterol will do is create a negative plaque that ends up kind of accruing or building up along the walls of the arteries and veins, and then we're in trouble.
Right.
So we need some, because most people that walk into my office are like, oh, my cholesterol's elevated, and I'm like, well, it's not that elevated,
Right.
and it's not that bad. So, and they're like, no, it's 190. I'm like, it's okay.
Right, and actually, really, cholesterol, 80% of your cholesterol is produced by your liver anyway.
Right.
So, 20% you can really control through diet and those factors. So, you're right. It's not as bad as people. Every time people hear cholesterol, they think negative. It's not really that way.
So this is just a sidebar, real quick, and I know you hate it when I do that,
Sure.
but I'm going to do it. But I mean, in my opinion, and I'm wondering about yours as well. I mean, most people really have elevated cholesterol levels because they eat so imbalanced.
Right.
I mean, our diets are so low in fiber. They're horribly low in fatty acids, healthy fatty acids specifically,
Exactly.
right?
Right, yeah, that's exactly why we see high cholesterol.
Yeah, because I see people when they take healthy oils and fiber, it drops 30, 40 points.
That's right.
Like that.
That's right.
Great.
Yeah.
That's an easy fix.
That's right.
So people need to do that. Okay, so do you think cholesterol, the measurement of your cholesterol, is the best way to determine your risk for heart disease?
The measurement of cholesterol, the measurement of cholesterol would be one of the ways to predict possible heart disease and cardiovascular problems. But cholesterol alone would not be the only way to do that. What I mean by that is there's good cholesterol and there's bad cholesterol. And so just going to your doctor and getting your cholesterol measurement, like you mentioned, somebody comes in the office and says, my cholesterol's 250. Well, that does not really tell you a lot. Actually, I was talking to a nutritionist down in Indianapolis last week, and she was actually doing a conference to medical physicians, and she was saying, I can't believe how many people still come into our office and say, I had my cholesterol checked, and they show her a lab report that just has total cholesterol.
Right.
She said that really doesn't tell her anything.
Right.
You really need to have your good cholesterol and bad cholesterol levels. Your good cholesterol is referred to as HDLs, high density lipoproteins, and then your bad cholesterol is your LDLs, your low density lipoproteins. And the ratio of those two forms of cholesterol is a good indicator of your potential risk for cardiovascular problems. And
do you also take triglycerides into account?
Yeah, we look at triglycerides also in that panel.
Okay.
So it's not just looking at your total cholesterol, but also really looking at
your lipids.
Yeah, all your lipids, and seeing the ratios that those fall into.
Right, and the problem, I think, for most people tends to be that we've got 3 potential hazardous lipids or fatty acids against one good. So the ratio should be high, and the one thing or the couple things that drive the HDLs up are exercise, which most people don't feel like doing, and then of course the good fatty acids and vitamin C, right?
Right.
Yeah, so, okay, so what should the ratio be of the good guys to the bad guys?
Yeah, your ratio of total cholesterol to HDLs, your good cholesterol, should be about 4 to 1.
Okay.
Your ratio of LDLs, your bad cholesterol, to HDLs should be about 2.5 to 1.
Okay.
And so those are the ratios when you're looking at, is this person in range? We would look at those ratios rather than just saying, wow, your cholesterol is 250, you better get on,
And
this
do
drug.
most labs do those ratios for you?
Yeah, most labs offer those, and really, if you're going to get a lab done, it's
Okay.
really, you really should get that done. Don't just get your total cholesterol done.
Let's have everyone get out a pencil and paper, and you could repeat that again if you would, Aaron.
Yeah, you want to look at, rather than just total cholesterol, you want to look at what are your HDLs, what are your LDLs, and then what are your triglycerides.
Okay.
And if you can get those, that will give you an indication of, whether you need to look at something to lower your cholesterol, or if your cholesterol is a little high, but those ratios are proper, then
It's okay.
then you're okay.
But you mentioned 2.5 to 1 for
Yeah,
the good guy to
your
the bad
total
guy?
cholesterol to HDL, which is your good cholesterol, should be 4 to 1, and then your LDLs, which is your bad cholesterol, to your HDL should be 2.5 to 1.
Great.
And actually, here's something interesting. If you get a 1% drop in your LDLs, your risk for heart attack goes down 2%.
That's a lot.
If you get a 1% increase in your HDLs, your risk of heart attack goes down 3 to 4%. So by altering those HDL, LDL numbers, you can really you can affect whether
Sure.
you're going to have heart disease or stroke. And actually, like you mentioned in the beginning, heart disease is the #1 killer in America, and stroke is #3, cancer being #2. So 2 out of your top 3 is cardiovascular.
That's amazing.
Yeah, and it's almost a million people a year, 700,000 through heart disease and 160,000 through stroke.
It's not a pretty picture. So we better do something to prevent this.
Right.
So that's a good question. What's the best way to lower cholesterol levels?
The best way to lower cholesterol actually is through dietary changes, like you had mentioned. We would recommend that they cut down their animal protein and cholesterol intake through those foods, and actually increase their fiber foods through vegetables and grains and fruits and things like that. That's the best way from a lifestyle point of view. Increasing exercise, which we don't like to do, but really it's beneficial. Stopping smoking, losing weight, all those things are factors.
Now Aaron, people are going to be sitting out there looking at this, and they're going to change the diet because we're going, okay, exercise, lose weight, eat more fiber. People are like, oh.
All the things they don't want to do.
But you know what? It's like, even if you start with one simple thing.
That's right.
And oftentimes, how many people do you meet that never drink water?
Yep, that's right.
Which means we recycle our fat, basically.
Yep.
It just gets, redistributed, or we just pack it in even better because we have no medium by which to push nutrients in and out of the cells with.
That's right.
So drinking water and eating fiber, I tell people start with a piece of fruit a day or a cup of vegetables a day if you eat none.
Yep.
It's a big deal.
If you take one of those suggestions, do it for 21 days, and then it becomes a habit, and then you take
add
another
another,
one,
right.
and eventually, if you try to do if you go from one extreme to the other extreme, chances are you're not going to be able to maintain that. But if you take one idea, do it for a few weeks, and then add another idea.
That's a really good suggestion. Otherwise, people are just like
It's
deer,
it's
a
too
deer in
overwhelming.
headlight.
Yeah.
Can't
It's
do
too overwhelming.
anything.
You might be able to do it for a couple days, and then you're, forget this.
Well, it's so interesting because as a clinical nutritionist, you start in one place and you come to another, but it's like you really can't be all or nothing either, because that's not life,
That's right.
But really, honestly, if you look at the fact that we all eat at least 21 meals a week, and if 18 out of the 21 were mindful
Right.
about doing things somewhat diligently
Right.
for our bodies, you're never going to age,
Right.
and you're not going to be one of those statistics
Yeah.
where we're, the heart disease category, the stroke category, the cancer category.
You can afford 3 fun.
Misdemeanors.
That's right.
Misdemeanors every week. Yeah, and we should, because that's what life is about.
That's
So tell us this. What role does fat consumption have in cardiovascular health?
A lot of fat is an interesting subject because over the last 15 years, you'll see a lot of no-fat, low-fat foods that people have gone to,
Right.
and basically for weight loss or to maintain weight. And if you look in general, our society has not become a thinner society; it's become
bigger.
bigger. And it's really it's not so much the fats, but what type of fats do you get. There are essential fatty acids that are necessary for proper health. And over the last 100 years, if you look at the American diet, there's been a big transition because of the way we've gone from the local family farm to the grocery stores, the supermarkets, and processed foods. And that invention of the supermarket has led to a need for shelf life, and so the foods are processed so that you can have maximum shelf life. And one of the things that is against shelf life is essential fatty acids, because they go rancid.
Right.
So what's happened over the last 100 years is we've gone to these refined vegetable oils that you find in many foods. For example, 96% of the vegetable oils that are found in our foods today come from corn, soybean, cottonseed, and canola oil. All of those oils are high in omega-6 and very low in omega-3. Omega-3 is an essential fatty acid that is necessary for proper cardiovascular function. And so it's just part of our culture, the way we distribute the food,
plus,
that's led to that.
If I can say something, Aaron, and this is really important information because I love oils. I'm passionate about them. Having studied in India, and Ayurveda uses oil and all the different modalities for healing. But the oils in America are processed in a very specific way, and they're highly, highly refined. And when an oil becomes highly refined, A, it becomes more stable, B, it becomes less bioavailable to the body. And oftentimes some of the refining components or chemicals are things like hexane, which are very degrading for the cell membrane, right?
Toxic,
They're horrible for the body. So we're consuming these highly refined, long shelf life oils that are killing us. And did you read lately, I don't remember what journal it was, I want to say it was the Journal of, I don't know, of Integrative Health or something, or Preventive Health. But they talked about this gooey, sticky plaque that they're finding in young men primarily, who are in their 30s and 40s, no symptomatology of cardiovascular problems. Cut them open, do an autopsy, and they're finding this gooey, sticky plaque that when they cut through it, when they serrate it, it actually pulls back together again.
Wow,
And their hypothesis is that this new type of plaque that's found around the heart muscle and in the chambers is a byproduct of trans fatty acids. And trans fatty acids are these highly refined, oxygenated, horrible oils that are all over the place in our highly processed foods.
That's why margarine, for example, is not not beneficial. You should really eat butter.
No, you're better off with butter.
That's right, and
body knows what to do with it.
Right, that's right. And those are the oxidized oils that your body does not really know what to do, and that end up leading to the plaquing and the hardening of the arteries.
Right.
And so that's really, even if you look at agricultural practices, free-range chicken eggs have a ratio of 3-to-1 omega-6 to omega-3, the good, the stuff you need for the heart. But the corn-fed chicken eggs, USDA corn-fed chicken eggs that we get right now, 19-to-1. So you go from 3-to-1 free-range chicken eggs to 19-to-1. So not only has shelf life and that factor played a role, but also the way we do agriculture. So it's just, there's been a transition over the last 100 years. If you looked 100 years ago at the average American diet, it was a 3-to-1 ratio of omega-6 to omega-3. Now it's average 19-to-1. So a big transition.
Well, beyond that, how many people are allergic to corn?
Right.
It's a very popular sensitivity, high sensitivity food or allergen.
Yeah, it's one of the top 5.
We're top 5.
Yeah.
So the hit parade, yes. Okay, so tell us about the cardiovascular effects of the omega-3 fatty acids, and where do they come from?
Okay, your omega-3s come a lot from fish. For example, I saw on the nightly news a couple weeks ago that the American Heart Association came out and recommended that people with cardiovascular disease in their family or a family history of cardiovascular event start eating fish twice a week. And really what they're recommending there is to do that because you get your omega-3s through your fish. Omega-3s they prevent atherosclerosis. They actually have an antithrombotic effect, anti-inflammatory effect. So even patients with chronic disorders like rheumatoid arthritis, any pain disorder would benefit from eating more fish in their diet, getting the omega-3s. They actually also, the omega-3s have been shown to reduce your LDLs, your bad cholesterol, and they've been shown to increase your HDLs, lower your triglycerides. So eating more fish, getting more fish in the diet will improve your cardiovascular health.
That's great. So more fish, but cold
Our
water fish.
Right, exactly.
Right?
Cold water fish, yep.
Not the mahi-mahis
Right.
or the lake trout or the stuff that comes out of Lake Michigan,
That's
right?
right, that's right.
So it has to be the stuff that swims deep in the ocean.
Yes.
Okay, so how can one increase the amount of omega-3s other than eating the fish? Could they take encapsulates?
Yeah, fish would be the best way just through the diet. And if you look at Greenland Eskimos have a diet high in fat, but they have very low cardiovascular problems in their culture, and that's actually become something that people have been interested in because they're eating diets high in fat, but they have very low cardiovascular event, and that seems to be contraindicated. But what they're eating is they're eating a lot of the cold water fish like you're talking. So that would be one way. The other way is really through, there's fish capsules that you can take, commonly referred to as EPA, DHA, eicosanoids, that you can take orally as a supplement that will give you, high levels of omega-3. And if you look what we were just talking about previously, the kind of the history over the last 100 years and how foods are processed, it's almost going to be impossible for a person to get the proper ratio of omega-6 to omega-3 totally in their diet. So it's almost imperative that they do supplement, on the side through nutritional supplements, and they can get fish oils, which will give them the omega-3s that they're missing in their diet.
What about getting their omega-3 from flaxseed oil?
Yeah, flaxseed oil is another good oil that they should take. The only question with flaxseed oil is flaxseed oil has to be converted to your to EPA DHA through an enzyme called the delta 6 desaturase enzyme. Some patients or some people, because they're eating a lot of trans fatty acids, they're eating a lot of French fries from McDonald's, and they're eating they're eating the average American diet. They don't have enough of that enzyme, or that enzyme gets occupied by the bad fats, and they don't convert their flaxseed oil to the EPA DHA. So
what can happen?
So in some ways it's really necessary just to give them fish oils.
Got
if they're
it.
not going to convert it, you just give them the EPA DHA, and that way it's there in that usable form. So, but flaxseed oil has other benefits too. So we would actually recommend a combination of the fish oils with the flaxseed oil for somebody with cardiovascular health problems.
Well, and something else that's interesting, and I read a lot of Dr. Patricia Kane's research, and she's just really a forerunner on EPAs and DHA and all these essential oils. And she's very concerned about the rancidity factor.
That's right.
So you have to be a really savvy consumer, and one of the best things, from what I understand, when you buy a fish oil in a capsule that you must look for is you prick it, and if it stinks really bad, it's rancid.
That's right.
So, and most of them are.
Yep.
I mean, you have to be very careful. I think Eskimo 3 is a really good company, and there's a couple, Norwegian something or other.
Yeah, what you want is a salmon, like a Scandinavian salmon that comes from the North Sea. And the other thing that's a concern with fish oils is the heavy metals and the pesticides. And you want a company that is tested for heavy metals and pesticides. We usually recommend a company that you can get through your doctor's office. Those companies tend to be companies that test for those things, and you're getting a more clean product. One of the other things that maybe you have listeners or watchers that have tried fish oils, but they don't like them because they get a fishy taste or they get the burpy regurgitation taste. There is a source, the company that I represent sells a burp-free source that actually, that's what they call it, a burp-free source.
No burps.
Right. And it's what they've done is they've removed the fish protein so that it's pure oil that you're getting, and you don't get the regurgitation or the burpy taste. And that's one of the compliance factors with fish oils is when you start recommending those to individuals, a lot of them will complain that, well, I know this is good for me, but I don't want to burp fish taste all day.
So what is the shelf life of an oil encapsulate, such as yours?
Well, it's usually a year. If it's encapsulated, it's usually a year. We recommend that when the bottle is open, they really refrigerate it. It will keep it from becoming rancid. But as long as it's in a bottle that is not transparent and that is sealed, your shelf life should be around a year.
Okay. And anything about omega-6s that you like?
Omega-6s, I mean, they're essential also. It's just that we tend to get a lot more omega-6 in the diet than we do omega-3, right? And so that's why we really focus more on getting, especially Americans who are eating the average American diet, more of the omega-3s, because that's what seems to be more deficient in the diet.
Right, for so long. Okay, what are some of the conventional treatments for high cholesterol?
Some of the conventional treatments would be drugs such as Questran. Questran is a synthetic pharmaceutical fiber that basically binds bile and it prevents the reabsorption of bile. And bile is loaded with cholesterol. So if you can bind that up and help it from being reabsorbed, you're going to get a reduction in cholesterol. The problem with drugs such as Questran is patients complain of a lot of gastric irritation. There's a lot of side effects to it. One of the other drugs that you probably, many people are on and recognize are drugs such as Mevacor, Lipitor, Zocor. Those are all your statin drugs. And your statin drugs, what they do is they block an enzyme. It's called the HMG-CoA reductase enzyme. That enzyme is a rate-limiting enzyme. If you can alter the amount of that enzyme, you'll reduce cholesterol levels or you'll alter cholesterol levels. It's involved in cholesterol synthesis. So what your statin drugs are doing is they're blocking that enzyme, and then you're getting the reduction in cholesterol. The problem, again, with a lot of your statin drugs is very toxic to the liver. That's why if you are if you're taking it, you probably are going to your doctor every 6 weeks and getting a liver enzyme check because you'll see that your liver enzymes start to go up. The problem with waiting to see if your liver enzymes go up is
once
that
they're up, we're in trouble.
Right. Once they're up, your liver is about 80% dysfunctional. So,
is that so?
Yeah. Once you see
That's
elevated
horrific.
liver enzymes, right? So that's not. I would not be one to say don't ever take statin drugs because there is a need at a point. But there's things you can do more conservatively that we should try first, and then if those work, then we're better off long term. If they don't, then maybe we need to consider other options.
Right. So give me, if you would, for our viewing audience, a litany of different options other than we talked about exercise, diet, right? Fiber,
the fishy oils.
The fishy oils.
Yes.
And then, of course, I'm sure there are some nutrients or supplements that you could recommend.
One of the things people probably have heard of is niacin. That's probably the most common thing. If you get outside of the drug route, people will try niacin. Niacin has been shown to reduce your LDLs, increase your HDLs, lower triglycerides. Now, one of the things is niacin has some side effects just like the drugs. Not as severe, but you get flushing. Many times patients will take niacin and they'll turn red. It'll last about 20 minutes to a half hour.
But that's the worst of it.
Right, that's the worst of it.
So it doesn't damage the liver.
Right, it doesn't damage the liver.
Which is okay.
Right. And
do people get hot or they just get flushed?
No, they get hot and they'll get flushed. One thing though, and there's a newer form of niacin that's actually been used over in Europe and is available in the United States called inositol hexaniacinate. It's a specific form of niacin that works just like niacin as far as the cholesterol benefits, but you don't get the flushing. So really, we would recommend patients not go find niacin, but actually look for this inositol hexaniacinate because they'll get the same benefits that they do with niacin, but they won't get the flushing and
Do you find this in a typical health food store?
You can.
A doctor maybe?
Yeah, a doctor would have it in their office more likely. You could find it in some health food stores. It just depends where you're going.
Yeah,
but in Europe, they've used it successfully for reducing cholesterol and increasing blood flow, and there's many benefits to it. One of the other things to mention on niacin is there was actually a study done in 1994, and it was published in the Annals of Internal Medicine, and it was a study that took 136 patients with LDL levels, so bad cholesterol levels, over 160, and they randomly either put them on lovastatin, which is Mevacor, or niacin. So they're comparing the effectiveness of the drug to just plain niacin. And as far as reduction in LDLs, lovastatin or Mevacor was a little bit better than the niacin, slightly better, but as far as increasing your HDLs, niacin blew it away. It was a 33% increase in HDLs with the niacin versus only a 6% increase with the lovastatin or the Mevacor. Right.
So how much?
How much niacin?
Yeah.
Actually, if you're using the inositol hexaniacinate, anywhere from 1,500 milligrams a day all the way up to 3,000 milligrams a day.
So couldn't people take less and take it longer and get the same results, or do you have to take high quantities and get the flushing to have the results?
Yeah, if you're using the inositol hexaniacinate, even if you go to a high level, you should not get any flushing. And what we would recommend is go up to the high level, 3,000 milligrams for the first 6 weeks, and it also depending on where your cholesterol levels are and where your your HDL, LDL. The higher they are and the worse that ratio is, then you would probably want to go up to the higher levels. If you're just a little bit off in the ratios, or your cholesterol is just a little bit out of range, then 1,500 milligrams, which you can usually get in 2 or 3 capsules, would be sufficient, and you wouldn't need to, go to the high levels.
That's great.
Yeah.
Well, this is very good information. I mean, so who wouldn't take niacin?
That's right.
I mean, that's silly not to.
Right.
There's no contraindications. Okay. So we talked about niacin compared to other drugs. The side effects, flushing. And if we get the hexanate, no flushing. Are there any other natural products that can be used to lower cholesterol?
2 other things that would be something you'd want to look for in a product. There's a product called artichoke, which is just, if you eat artichokes, if you like them, you can do that. But
lots of them. Peeling those little leaves.
Right.
Okay.
But artichokes, what they do is they cause the liver to dump bile, or they're a choleretic, so they help clean the liver. Well, as I mentioned before, bile is loaded with cholesterol. So if you can use artichoke to cause the liver to dump bile, and then take fiber. Fiber will bind up that bile and remove it through the stools.
Cool.
So that's another way you can reduce cholesterol, is using the artichoke and the fibers, together to reduce your cholesterol
And some
levels.
people literally don't produce enough bile.
Right.
So taking an ox bile product, or a product that's bile laden,
That's right.
will help you to actually break everything down more efficiently.
Yeah, with digestion, very good approach. One other herb that may be beneficial is a product called Google Lipids, which sounds funny, but but Google Lipids has a long history. It's an Indian herb that's been used for reducing cholesterol. Not only reducing cholesterol, but specifically, again, reducing your bad cholesterol. It actually, what it does is it increases the number of LDL receptors on the liver, so it
Really?
allows the liver to pull more LDLs from the blood. So what it's doing is reducing your bad cholesterol again. So
where do you get those Google Lipids?
Google Lipids. You can find them in various products, possibly through your health food store, or for sure through your health professional.
Okay, cool. And they sell straight Google Lipids, or in combination with other herbs?
Google Lipids, an approach to cholesterol would really be to combine some of the things we're talking about. You don't really need to find a product that's just niacin and then find a product that's just artichoke and then fiber. There are companies out there that actually put it together in a formula so that you can take, 3 capsules of this formula per day and be getting the benefits of the niacin, the artichoke, the Google Lipids. Makes it more easy for compliance, because if you tell somebody takes 6 different products 3 times a day, compliance goes way down.
Right. So if people take some of these products that we've mentioned, they should see results within what, 2, 3, 4 months?
Yeah, usually what we would recommend is if they've recently had their blood analyzed and they see they're a little bit high cholesterol, they've got a poor ratio, to do the natural products for about 3 months, then rerun their blood and see where they're at. And usually it's not uncommon to see a 50 to 100 point drop in cholesterol, and to see those ratios really come into the proper...
Isn't that fabulous?
Right, it is. And really, if you look at, since the pharmaceutical companies have really started to promote their products, you see them more on the TV and magazines and things like that.
Right.
Some experts have really become concerned, especially in the area of cholesterol management, because the drugs have such toxic and negative side effects. You can really accomplish many of the things we're talking about through a much more conservative, safe approach. And try that first, and you can always go the other route if you have to, but so many people benefit from the more conservative approach and don't have all the negative side effects.
Aaron, as usual, this goes too fast. Thank you for being here. It was wonderful. And listen, if you have any questions at all, you feel free to give me a call. I'll refer you to the products that Aaron mentioned for us. And you know what? Until next week, take good care of your health. May you and those you love be blessed with the gift of abundant health. Good night. I'm Deborah Arneson with Health Quest.